Yeah, thank you, Ted. Thank you, everyone, for sending your questions through. We have received quite a number. So we will start with the first one, which is about if you could tell us, Ted, the question is obviously to you, if you could tell us about the impact of the COVID-19 pandemic on children in camps. Are COVID cases worsening? And what are the supplies and types of assistance that are required? I think you've touched upon some of it in your briefing, but over to you if you'd like to add.
Sure. Thanks, Juliet. Let me give a few more points then on COVID-19. First, to say that all the countries in the region have obviously been affected, and that COVID-19 has not spared internally displaced or refugees. We've had cases of COVID-19 amongst the internally displaced inside Syria, and amongst the refugees in all of the neighboring countries. Let me just give a couple of numbers for inside Syria. So, inside Syria right now, we've got 16,000 confirmed cases through laboratories of COVID-19 and 1,000 associated deaths. And we estimate that that's an underestimate because the number of COVID-19 cases continue to rise, and there are issues with testing capacity. So clearly the numbers are higher than that. And I think what's important, and the first thing we've done about it, is to continue to emphasize, both in Syria and in neighboring countries, the importance of the physical distancing measures, wearing a mask, washing hands, keeping as conscious of being separate when we're together, meaning at a certain distance, especially with people beyond family and people that we're very close to intimately. And we've had I think a major role there. I think we were able to reach 55 million people within this area with messaging about what to do to protect yourself from COVID. That's been really, really important. Secondly, in terms of what we've been able to do about it, we've been able to focus on making sure that people have trust in services. You've got malnourished children that need immunization. And what we saw initially during COVID-19 was a drop in the number of people, of families, of children using health services. And we were very worried about that because you can then either get sick or die for other reasons and other causes. So we really worked with the authorities in different countries to reestablish contact between the population and the health system. And I'm very glad that immunization has resumed pre-COVID levels. So families are taking their children to be immunized. We now need to do the same with maternal and newborn services. So as women deliver, that they're following up with the health centers. There's ways of doing that safely. And that's why we put such a heavy emphasis on the delivery of PPE kits to frontline workers. The third thing we did is indeed focusing on the issue of learning and supporting countries, as you saw in the video from Jordan, for blended learning. The point that UNICEF makes is a child both needs support with remote learning, so digital access to the materials and the studies, but that's not enough. We're really encouraging blended learning where you come in part of the time in shifts, again, physically distanced, but again, that you're able to have a contact with a teacher or someone who can help you go through some of the materials. And lastly, let me say, there's much more I could point to, work on infection prevention and control, work on psychosocial support. But lastly, let me say, as I said in my remarks, but I think it's important to emphasize, is this focus on making sure that the vaccines are available. So, Jordan, Lebanon, Turkey, they've had their own bilateral arrangement to get initial vaccines in. As I said, Jordan is among the first countries in the world to vaccinate refugees, and all these countries have included the refugees in their plans, but both for neighboring countries and for Syria itself. They are accessing the COVAX facility, which tries to make sure that vaccines are available to countries in an equitable manner, that we go beyond this vaccine nationalism, which frankly has been a real issue, and that indeed frontline workers first, people with underlying conditions second, the elderly, and then ultimately all of us can have access to vaccines. So, as we speak, the first COVAX deliveries are arriving in Jordan. We have dates for their arrival in Lebanon, in Syria, and Turkey, and the other neighboring countries that have done so much to support Syria refugees.
Thank you, Ted. We have a question from the national newspaper in the UAE from our colleague James Reinl. He's asking, please tell us about Al Hol camp. We hear shocking stories about foreign fighter children, so mothers of foreign fighters, or wives rather, asking to register children as orphans, which gives them a better chance for getting a home. How do you cope with such awful conditions, and in particular the recent spate of murders and ISIS violence in the camp? That if you can tell us all about your visit specifically. I mean, you're one of the very few people in the world, I would say, that had access to the quote unquote annex where there are these mothers that James is talking about. Tell us a bit about that.
Let me give you the picture. Al Hol camp is a camp with 60,000 people, of which 41,000 are children. Of these 41,000 children, 19,000 are Iraqis, 14,000 are Syrian, and about 6,400 are third country nationals. They come from other countries, and those are the ones in the so-called annex. They're in a specific part of the camp. For the camp as a whole, it's a precarious situation. It's a situation that's not fully secure. We're doing our best to provide services, but frankly, this is not where these children and their parents should be. In the main camp, so where the Iraqi and the Syrian children are, there's a full range of services: education, water, health. It's relatively accessible. It's not an easy situation, but it's a situation that we're doing our best to address. In the annex, it's harder because that's where you have the third country national children with their mothers. It's quite a tense situation. We're again providing services when it comes to health, when it comes to water and sanitation. We're working with other agencies on health issues. And we're having a discussion with the mothers about providing the right kind of education and addressing the right kind of education need for the children. The main point we're making is, it's time for the Syrian children to go back to their communities in Syria, and that's happening. Specifically in northeast Syria, we've already seen some Syrians going back. It's time for the Iraqi children and their mothers to go back to Iraq, where if there are procedures from a justice perspective to be addressed against the mothers, then that's what should be done. For the children, they should not be in a justice procedure only by virtue of being part of a family that got caught up in this conflict or that was associated with an armed group or an extremist group. If there's a specific issue a child should done, then they should be allowed to access juvenile justice procedure in their home, in this case, Iraq. And the same is true for the children from the over 60 countries around the world that are in the annex. I have not heard of specifically children being put up as orphans so that they can get back home more easily. We do have, as UNICEF, 2 interim care facilities, interim care centers that have 101 completely unaccompanied children. These are children without mothers or fathers or aunts or uncles in northeast Syria, but they have relatives back home in Central Asia, in North Africa, in Europe, in Asia. And what we're saying specifically is get those kids home first. The interim care center is no place for those children. They don't have relatives there with them, but they have relatives at home. So it's critical that these children get home, and we're advocating with every single member state to take their children home. We understand that when there's a mother present, it's more complex. But even then, our position is take them home and then address whatever issues that the mother needs to address back home. Because the longer they stay in these conditions in the camp, the worse the situation is for those children. And it's very clear, despite the best efforts of humanitarians, uh, many organizations involved, non-governmental organization, UN agencies, despite those best efforts, this is not in the best interest of the children to stay there in the camp.
Mm, mm. Thanks, Ted. Ted, there are two short questions that I'm going to ask you. One is from Pablo from Radio Estrada, and he's asking if there's been an increase on child labor. I assume he means inside Syria and in the neighboring countries, and I assume it's recent because of COVID and the likelihood of the increases. And then there is a question from Juan Ata. He's from a European radio station. I don't know the abbreviation, but he's asking about the psychological impact the war has had on children.
So thank you for those questions. We have had an increase in child labor. I don't have the exact statistics, and this is something that we continuously look at. But it's very clear that two things have happened. One is an increase in child labor as a coping mechanism, and the other one is an increase in child marriage as another coping mechanism. And we're working with families and communities to try to address both. Now, you saw the video from Aleppo and the group of students that were there, and everything they were doing, from tailoring to working as carpenters. I've met kids who work in fields in Lebanon picking cucumbers and tomatoes. Children working in pastry shops because back home their dad used to work or own a pastry shop. And what we're trying to do is two things. Firstly, is try to provide more of a safety net on the families. So, our colleagues in WFP are looking at issues of the food security and the food basket, as you heard in my introductory remarks, concern about poverty, concern about the price of the food basket. From our end as UNICEF, we're trying to look at cash transfers, removing barriers to access to education, to health, so that families can have more than one way to address their needs. And both in Lebanon and Jordan, but also inside Syria, some of these cash transfer programs, which frankly are not at the scale that we would like them to, but still what they do is support families to have some cash on hand, some resources to be able then to have more than one coping mechanism. And then when the children are involved in labor, then how do you specifically try to make the case that that labor is not egregious, that it still allows for education and learning? So we heard of the one child that was doing 10 hours of work a day, and then he had cut back to 4. So 4 is okay if the child is 15 or 16 or 17, can help their family, but at the same time still do their learning. So how can we find those kind of solutions, which we understand are sometimes, unfortunately, the reality of the Syrian child? How can we have the hours of learning be such that if you're working in the morning, you can study in the afternoon? So, I mean, those are some of the difficult issues that we have to work with and address, and it's been a real concern. On psychosocial, very good question, and really this last year has been extremely difficult. I mean, it's been the conflict plus the economy, which really has gone into a free fall in Syria. Also, Lebanon is under immense stress. And then COVID, and not being with your friends, not being at school, not being able to circulate. But what we've seen, and again, we're actually going to be doing a more formal report before the end of the month, and hopefully you'll be able to cover that too. But what we've seen is a doubling of reported cases of psychosocial distress in the last year. So 1 in 4 children surveyed inside Syria are facing the psychosocial distress. Overall, as part of a COVID survey in Syria and neighboring countries, anxiety, night terrors, concerns about the future, affected roughly half of children. The issue there for us is how do we support families to deal with this when they themselves are under economic pressure, under economic stress. So, a lot of engagement around positive parenting, what to do with children, hotlines put in place in Lebanon and Jordan and Syria. Um, I'm afraid we're not there yet in terms of scale, but there's a recognition that this is something that needs to be addressed. Thank you.
Thanks, Ted. Tell us maybe at the back of that, what is needed? What does UNICEF need to get there?
So look, like every year, we appeal for the resources that we need. Right now, the appeal for the work that we do, the work that you saw globally, is $1.4 billion for the whole of the Syria response. So that's both for Syria and neighboring countries. It's through the generous contribution of governments, individuals, frankly, through the advocacy that you do through the press, that we've been able to sustain the response. And we've tried our best to be, cost effective. So the work on water that you saw in Zatari, for example, it started being water trucking, which is very expensive. We now have a piped system, which is, relying on groundwater, which is much cheaper. So over time, we've tried to be more effective, but we need to sustain the response. The humanitarian response is the safety net that the populations, both inside Syria and the refugees outside Syria, depend on in terms of their well-being. They are enormously resilient. There's so much that they do, and frankly, there's so much that the authorities do as well. But UNICEF, WFP, WHO, UNHCR, the NGOs, the other partners, they do a tremendous job also being there, and the resources are critical. We're also advocating for, firstly, a peaceful solution. What the economy has shown us is there are no winners in this conflict. There needs to be genuine focus on the peace process, the UN-led discussions around the constitution and the way forward politically, that the special envoy Geir Peterson is taking. That is the way forward. We're calling for a renewal of the cross-border resolution to allow work to continue into northwest Syria, where 4 million people, 2 million children are depending on the lifeline from cross-border into northwest Syria. And frankly, there are no alternatives to the cross-border resolution. Yes, cross-line helps, but we need cross-line and cross-border. We're calling for support to Syria's neighboring countries, and specifically to Lebanon, to address the economic situation that it's dealing with. And we're calling for a continuation of a focus on social services. You need to maintain the services in place. So to give you an example, we have over 500,000 children in the Lebanese public education system. That's Syrian and Lebanese children. And that public education system is even more important now as Lebanon is going through its own economic difficulties, both for Syrian and Lebanese children. So to be able to continue to support that system, despite the political difficulties in Lebanon, is critical. And I'm using that as an example, but for you to get the sense. Thanks, Juliette.
Yeah. No, thank you, Ted. Ted, we have 3 questions from our colleague Hiro. He is from TBS Tokyo, a Japanese outlet. And I'm going to ask you the 3 questions because I think they're absolutely critical. The first one is, which areas inside Syria are especially in need for support and why? The second one is, do you, as UNICEF, face any difficulties accessing children in rebel-held territories, and why? And then the third one is about children recruited into the fighting. So if you can give us the latest on that, and what do these specific children use and or need rather in terms of aid over to you.
Thank you very much, Juliet. Let me take them in the order in which they were asked. So, firstly, inside Syria, we've got needs throughout the whole country. They're different in different parts of the country, but they're there throughout the whole country. You've got an exhausted population. 90% of Syria's children depend on aid. 80% of Syria's children are below the poverty line. I mean, imagine those numbers, those staggering numbers. And yet, if I were to say what's my area of immediate concern, I would say my area of immediate concern is northwest Syria, where we've had a population under a lot of pressure. There's been a ceasefire which needs to continue since March, but we've had floods. We've had a very brutal winter. We've had displacement due to the previous fighting, which was never fully addressed. And so it's critical that we also focus attention on the northwest of Syria. It's immediate because we need to be ready for any contingency for the rest of the year related to the cross-border resolution. So while overall we're asking for $1.4 billion, we're specifically asking for an immediate $40 million now for northwest Syria. But frankly, the whole of Syria is at need. In terms of access, I mean, we've had reasonable access to a large part of Syria. There are bureaucratic impediments that occur, but frankly, it's gotten better. We've had a much more robust presence in Qamishli, which is in northeast of Syria, where there's been concerns. There's a band of territory around Deir ez-Zor, which is not easily accessible because it's in the hands of armed groups that have an extremist bent. And of course, we continue to be concerned about being able to access northwest Syria, as I mentioned, through the cross-border resolution accurately. So there are pockets around Deir ez-Zor in the northwest, around the Afrin area that we need to continue to work and advocate for better access. But there are different ways through local organizations, through third-party monitors that we do our best. And what we as UNICEF cannot do, there are NGOs that also do their work cross-border, cross-line, through different modalities. On the children that are recruited into fighting. So we, over the last 10 years, have maintained a mechanism. It's called the monitoring and reporting mechanism that monitors the situation of grave violations. And the grave violations are Security Council violations that look at children affected by armed conflict, from recruitment to killing and maiming children, to attacks on hospitals and health facilities, to denial of access, to abduction. And our statistics show that 5,737 children, some as young as 7, as I said, have been recruited by, frankly, all the parties to the conflict in Syria. And we have been negotiating and talking to the different parties so that they do their part, both to release those children that are still with them, but also that they refrain from recruitment, whatever the reason is. Sometimes a 17-year-old or a 16-year-old may say, I want to join this group or that group because I believe in the cause. Sometimes they're taken forcibly. The whole range of rationales, whatever the reason, it's not a place of a child to be in an armed group. And so we're working towards that. What is also true, and I think that's behind your question, is that once the child's returned, they need a lot of support, and that's a really important part of the process. It's the whole reintegration of that child, the psychosocial support they need. They need to rediscover how to be a child. They need to re-access learning. They need to re-access education and that sense of normalcy that comes from being a child. Right now, again, our main concern is in northwest Syria. 75% of the violations in 2020 were in the northwest of Syria. And so that continues to be where we're concerned in terms of issues of recruitment specifically. And that's going to be a big part of our focus in 2021.
Great, thank you, Ted. A number of you colleagues are asking how to use the videos that we used in both the field trip, the virtual field trip, both to Jordan and to Syria, and also to the 10-10-10, which includes interviews with children that we've been working with for the past 10 years. So all of this can be downloaded and used from our website. After this press briefing, we will be sharing a recording of this press briefing and also a link to all the multimedia material with colleagues from UNICEF who are able to give you high quality material, including for the use in broadcast. So please stay tuned. If you're not on our mailing list, please send us in the chat box your email address and we will add you to our mailing lists. And if you'd like, we also have a WhatsApp group. So you can send us your WhatsApp number and we add it. And it is a silent WhatsApp group. So it's a broadcast, so there's no chit chat. So don't worry about any noise. Ted, are you ready for the next question?
Sure.
Okay, so we have a question from our colleague Tom. He's in the Independent newspaper in the UK. And he says it has been reported that the UK government is considering cutting aid to Syria by 2/3 from 137 million British pounds last year to just over 45 million this year, as well as to other countries such as Yemen. What is UNICEF's reaction to that? You may recall we've seen this story in the BBC about that, where also they mention, in addition to Syria, Lebanon. What do you have to tell us, Ted, on that one?
So firstly, Tom, let me say this is as we understand that it's not official. It needs to be confirmed. And I think that would be the first thing to say is it's a report. Clearly, we need to hear officially if that's the case. And if it were the case, obviously it would be of concern. But I also want to say that the UK has been one of UNICEF's largest donors globally and is one of the top UNICEF donors in the Syria crisis. You know, since 2013, the UK has been hugely generous, given nearly $500 million in US dollars, that is, of assistance to UNICEF for the response both inside Syria and in neighboring countries. It's allowed us to make a huge difference, as you saw on the videos. So very much hoping that this is, you know, part of a discussion, but that is in fact not confirmed as it comes out. And indeed, for all donors, for the UK, for all the donors that have been so generous, you know, the Gulf countries, the neighboring countries, you know, investing now in this crisis and continuing to invest makes a difference. It avoids a lost generation. It makes sure that children don't experience and therefore end up acting out the worst. And I think it's extremely important that we stay the course. Again, the UK has been so generous. We've got to believe that they will continue to be supportive and continue to support the response in Syria, in Yemen, and elsewhere.
Thanks, Ted. Ted, there is a question also from the national newspaper, and then related another question also on education. The latter is in fact about education inside Syria and schools inside Syria. So that's a question. And then the other question relates to the 5 million kids who are inside Syria and in neighboring countries who continue to have access to learning. And the question is related to the funding that UNICEF is asking for to continue to keep these children in learning. Over to you.
Can you repeat the first question, Juliet? I didn't get the first question.
Yeah,
I
the
skipped
first
right to the
question
first
was
question.
about education inside Syria, Ted, and the schools inside Syria, and what is it, what is the big picture, if you wish, on education inside Syria?
The big picture on education inside Syria. Okay.
Correct.
So firstly, let me say that each of these 5 million children is a ray of hope. When we meet these children, I was before I went to Northeast Syria in December, right before the pandemic started. So a year ago, basically, I was in the southern part of Idlib province, and we saw a school in a small village. You go through that part of the country and it's mainly deserted villages, but there was this one little school which had brought together children who had been refugees in Lebanon, children who had been internally displaced, and children who had never left. And it was about 200 children studying, and being children. And it was just so powerful to see those kids, because each of them basically represents someone who is investing in their future. And 5 million of these children exist today. So we still have a huge amount of work to do. There's still, while there's 5 million children in school, there's 3.2 million children out of school, both inside Syria and in neighboring countries. And really, I mentioned the $1.4 billion that we're appealing to this year. The vast majority of that, 700 million, a bit less than 700 million of that 1.4 is for education, because we recognize what Syrian mothers recognize, which is this is the most important thing we can do. And inside Syria, this is both formal and non-formal education. I think that goes to your question. It's the kind of catch-up learning that you saw in the video from Aleppo, where it's a second chance education. You can come back to learning and either at least get some skills or actually get back into the formal education system. It's self-learning materials that go throughout the country, including in territory that's not held by the central authorities in Damascus. And we're just saying, let's have as many channels of learning and let's support those channels of learning, because again, that's what mothers are saying gives them hope in terms of their children. I think Juliet, the second question was around the appeal. I didn't write it down. Is that correct?
The second question was about, the first one was about the 5 million kids and how, I
Yeah.
think you covered it actually, Ted. The second question was about the situation of schools inside Syria. Can they be used or not? And that I think you've also covered.
Maybe
Unless you
to
want to
add that
add something.
about
Yes, please.
about a third of the schools in Syria have been damaged, destroyed, are used by IDPs, or are used, frankly, for military purposes, and that's part of what we track and advocate for the relief, the return of those schools to learning purposes. But again, learning can occur in a community center, like you saw in Aleppo. It can occur under a tree. It can occur formally or non-formally. So it is important that the infrastructure is there. It is important even more that students have access to the learning materials, to the teachers, and the support to get to exams, all of which UNICEF works on, both inside Syria and in neighboring countries. I mentioned the Lebanese education system, the public education system, which is so critical to provide a chance for Syrian children to study, but also, frankly, increasingly to Lebanese children who cannot afford to be in a private school. And then, we've invested heavily, and there are issues with management, there are issues with the politics in Lebanon, but frankly, it's essential that that system continue to be there. What we're seeing from Morocco to Lebanon as the COVID crisis has hit us is more and more children coming back to the public education system, because that's a system that they can afford. Families are having to make hard choices. They don't have the resources often to keep their children in private school when they're figuring out where the next meal is going to come from.
Thanks, Ted. Then there are two questions on the COVID-19. One specifically asks about COVID-19 in refugee camps and among refugees, which I think you covered, but if you'd like to say something else, including on when the vaccine, assuming COVID vaccine will reach them. So that's one. And related to that is a journalist from TSF radio in Portugal. She's asking that she spoke to an aid organization, and they told her that the situation of COVID inside Syria is not very bad. What do you have to say to that? So the second question is from Portugal. The first question is, by the way, from a Rai newspaper in Kuwait.
Okay, thank you very much, Juliet. So on the first question, let me perhaps be precise about what I said earlier. Firstly, is that all the countries, Jordan, Lebanon, Turkey, have submitted vaccination plans that includes the refugees. And that's really important because they've recognized what we all recognize, which is no one is safe until everyone is safe. And as I said, Jordan, among the first people vaccinated in Jordan, there was symbolically some refugees being vaccinated. Again, according to the priority list, frontline workers, uh, 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 the elderly, people with underlying conditions, etc. But what's important is that in the operationalization of these plans, that spirit continues to be the case. And I think Jordan is the farthest along in terms of immunization, but in no countries have we yet seen, scale in terms of everyone reaching vaccines. As I said, Jordan is moving quite well, but in all cases, I think part of our dialogue with the authorities, our support in terms of COVAX, our support in terms of there's something called the humanitarian buffer, is going to be to make sure that there is an equitable distribution of vaccine within the population, again, according to the country's own prioritization and ranking, and that the refugees are not treated differently or separately. Now, frankly, that's something that we'll need to continue to work on and advocate. Equally, it's important that vaccine nationalism doesn't continue to prevail, where we have rich countries having, more than, the population's need in vaccines. And that's indeed where COVAX comes in, where the COVAX facility comes in, where the work that WHO, UNICEF, Gavi, and others, the World Bank and others are doing to make sure that's the case. It's a work in progress. I can't give you something more specific at this stage because the vaccines are only arriving this month, essentially, from COVAX, in addition to whatever the governments have arranged bilaterally in the case of the neighboring countries. And just finally, let me say that within Syria, we're keeping an equal eye on making sure that the Northeast and the Northwest get their share, and working both with the ministries of health, but also in the case of the Northwest, as a completely separate application to make sure that that's the case. On the question of the status of COVID within Syria, as I said, the reality is that first of all, COVID is it's a global pandemic. It's a problem everywhere. Everyone's been impacted by COVID. The issue is, in many parts of Syria, you may not have the testing capacity to be able to confirm it's COVID. So I would never say that COVID is not serious in Syria. Syria has many issues, but COVID is one of them. And I think what we can do is to continue to make the case to follow social, or rather physical distancing measures, wear the masks, wash your hands, be careful when you're in groups, keep 2 meters between yourselves, be conscious that this is a real disease that kills people. And then, use the health centers. Don't be afraid to use the services that are there. Check in if you're not feeling well, because early detection is the best way to ensure early recovery. And then next, as I mentioned to our Kuwaiti colleague, get prepared for vaccination. Let's fight this vaccine hesitancy. Getting vaccination is part of the solution. These are vaccines that have gone through rigorous testing. If you are called to be vaccinated, if you're part of the category of priorities, by all means, take your vaccine. Vaccination is one of the most effective public health measures that we have for COVID and for the major killers of children, the major diseases that kill children.
Great, thank you. Ted, do you want to tell us a little bit about that? Your last point, vaccination of children. How has that impacted during COVID? I know it's a bit of a diversion from Syria, but when it comes to routine immunization, because someone asked about it in the chat, how has that been impacted by COVID?
So, throughout the Middle East and North Africa, as I had indicated, we had seen a significant sharp drop in the utilization of health services because people were afraid. People were afraid of going out. People were afraid of going into health facilities. Health workers themselves were afraid of going to health facilities. So I think we worked on three levels. One is to get accurate information about how to what to be afraid of and what not to be afraid of. Second, we supported countries to get PPEs to frontline health workers, and not just frontline health workers that were working on COVID, but frontline health workers that were part of the primary healthcare system, the health posts, the health centers that provide vaccination, that provide public health services. Thirdly, we actually helped, it was quite creative. We helped provide training, WHO, UNICEF working together to provide training to health workers as to how to minimize contact. So if a child's coming in and they're malnourished, we actually developed a mid-upper arm circumference bracelet that the mother could administer. So the health workers didn't have to touch the child. The mother could use the MUAC to measure the nutritional status of the child and reduce contacts, so that you had trust that if you came in, you'd get the solution without necessarily being exposed. Same with immunization and other, how to minimize the number of steps that required contact. And I think as a result of all this, as a result of advocacy, we relied on ministers, on public figures, on religious leaders to encourage people to start going back to the health system. Whereas at one point we had seen a 30 to 40% drop in immunization level, we're almost back to pre-COVID levels now in most countries. And that's really, really positive. Where we now need to do more work, as I said earlier, is on maternal and newborn care services. So when the mom is pregnant, that she goes into the health center to get a checkup. When the child is born, that the child gets brought in to get their checkup. So, again, slowly, that trust is being reestablished. And we're really glad that on immunization in particular, that has been restored. And I have to say, throughout the crisis, despite COVID, when there were no flights, we did everything possible to arrange for the vaccines to get to places like Yemen and Syria, sometimes using really innovative flight routes and flight patterns. So at the very least, vaccines against measles were there, vaccines against polio were there. And I'm very proud to say that we did not have an interruption in the vaccine supply in any of the countries that asked us to help during this crisis.
Fantastic, thank you.
Middle East and North Africa, yeah.
Thank you. If we go back to Syria and in particular to Syrian refugees, we have another question from Tom in The Independent. He's asking about the possibility of the return of Syrian families from neighboring countries back into Syria. And if yes or no, what does the future hold for these children, for children who live now as refugees in Syria's neighboring countries?
So a couple of things. I think the United Nations position is that return has to be safe, dignified, and voluntary. And we're seeing small numbers of people returning, but the vast majority of refugees are going to make their own choices. And I think the United Nations position is that it depends on the individual family's decision based on those criteria. What we are seeing, however, and this is important, is hundreds of thousands of internally displaced going home. If that's frankly critical. And I can give you an example of when I was in Eastern Ghouta, in the outskirts of Damascus, again, right before the COVID crisis at the, a little over a year ago. And we were seeing families going back to homes which were, half bombed out. And they're, using the latitude that we have with humanitarian infrastructure. UNICEF was laying down pipes, water pipes, so water was accessible. Schools were being patched up. It's important to repair schools. You don't want the roof collapsing on a child, so that when they're learning. Providing psychosocial support. We need to reestablish basic services using that window. So that families can go back to their homes of origin from within Syria. So, HCR can give you the exact number of refugees coming back from neighboring countries. I just listed the criteria that the UN generally calls for that return to happen. It's equally important that we recognize that there's hundreds of thousands of internally displaced that are returning home. And that the support that they need to be able to do that is there and in place.
Okay, excellent. Thank you very much, Ted. I think we covered most of the questions, if not all of them, that came to the Q&A box. So I'm just, since we have you for another 20 minutes, I'm just asking colleagues who are on the line with us if they want to ask anything else. If not, then we will thank you very much and sign off. So let's wait just maybe for a few minutes. And the UNICEF colleagues behind the scenes, if there's who've been helping with this event, if there's any questions that I've missed, please send them to me. And I think we covered them all.
Okay, Juliet. Well, listen, I want to thank all the members of the press that have been with us here today. It's so important that you continue to focus our attention on Syrian children and their needs. We have to stay the course. We have to be there with this generation of Syrian children, which frankly is the hope for the country, in terms of the future. And I'd like to thank all those UNICEF colleagues behind the scenes that have made this happen. These are not usual times for these kind of conferences, press conferences. So I'm glad that we're able to do this today.
Thank you, Ted, and big thanks to the colleagues as well who put this together. And thank you all for coming to our press conference. And hopefully next year it will not be about Syria, and it will be in person about something very positive in this region. We look forward to staying in touch. And until then, you can stay with us for a few more minutes. We will run some of our videos. Thank you again. Have a good evening, good day, wherever you are. Stay safe and see you soon. Bye.
Bye-bye, everybody.